Welcome to Gloria's Gab Live. I am delighted today to have a wonderful doctor in our community, pulmonary uh,
Pulmonologist,
pulmonologist,
pediatric
but pediatric,
pulmonologist,
yeah, Kunjana
Kunjana Mavunda.
Mavunda. Okay, there's a mouthful. uh, Such a delightful person and is so busy. And wait until you hear what she has to tell us about. Um, we're going to talk about asthma today and a lot of things associated with most people don't know about. But before we go into our show, I want to thank my show sponsor, South Florida PBS. If you're not a member, you need to be. They give you a magazine once a month that gives you all the latest things that are happening. There's a lot of great shows coming up, Masterpiece Theater, Benjamin Franklin. I've got Recorded, Sedition, so many great things. Do you watch? Do you have?
Yes, I
Yeah,
do.
yeah.
Actually,
Of course you do. Everybody does. And of course, they have that allhealthtv.com, which is a great resource in our community. So check that out. So let's talk about asthma because I know a lot of people that have asthma, and we were talking about things that most frequently asked questions. But first of all, explain what asthma is, and then we can go into other
So,
aspects.
asthma is a common illness
Right.
that kids and adults have. Uh, in children less than 2 years of age, it's sometimes difficult to diagnose asthma
I would think.
because the symptoms of asthma are similar to symptoms of viral infections in the younger children. As they get older, the diagnosis becomes easier. So, with asthma, what happens is that you have a lot of mucus production,
Mhm.
your airway gets swollen, and you have muscles around the airway that start contracting. So, I brought these lungs to just
Okay.
show
Want me to
you.
hold it for you?
And I'm not
Okay.
sure if you can see it properly, but
Yeah, you can.
this is
Okay.
what a normal airway would look like.
Mhm.
It's just a tube that the air goes back and forth.
And
And
very
then you
open.
have
Yeah.
muscle around it that kind of contracts and opens up depending on how the symptoms are. So, this is
Yeah.
what the normal airway would look like. When patients start developing asthma, the inside gets swollen. You start having a lot of mucus, and this contracts. So, many times, by the time patients go to the emergency room, that this is what the airway looks like. You see how narrow the lumen is, how swollen the airway is, how much mucus there is, and then all these muscles that are contracting, so the patients have a difficult time breathing. So, sometimes what happens with children less than 2 years of age is when they get the virus itself makes them produce the mucus and irritates the
Oh.
airway, etc. So they're diagnosed as having a viral illness and they're treated accordingly. But what we say is that if a child keeps on having to use medications like steroids and aerosols when they have viral illness, then we need to start thinking about asthma. The other thing is that when a patient is seen in the emergency room, and this is really important for people to pay attention to, when they're seen in the emergency room or hospitalized for something like this, it takes up to 4 to 5 weeks to normalize.
Wow.
And it will normalize only if you have the right medications and if the environment around you is clean air like you have in hospitals, so that it dust and other things don't keep on irritating the airway. The reason I say it's important to remember this is because when you're seen in the emergency room, you're going to be given steroids for 5 to 7 days, and you're going to be given albuterol aerosol to open the airway. So the steroids decrease the mucus, they decrease the swelling in the airway, and albuterol opens up the airway. But when you leave the emergency room, you're going to get unless you're on chronic medications, you're going to get medications only for 5 to 7 days. So it's really important to make an appointment with your primary care physician or your other physicians to make sure that you continue treatment until the airway normalizes.
So it takes 6 weeks?
4 to 6
That's
weeks.
amazing.
And so with children, sometimes what will happen, I'm a pediatric pulmonologist, so I talk more about children. With children, what happens is that sometimes, and this is something you hear all the time, children going to daycares, that they're constantly sick and coughing and
Exactly.
wheezing. So let's say that a child was seen in the emergency room. They were given the steroids and the
Right.
albuterol. The child's airway went from here to here, so that's
Almost good.
improved, but not quite. It's still a little bit swollen. It's still a little reactive. So then they'll get a virus on top of this
I was gonna
before it has cleared, and immediately they'll go to this. So
So it's
that
really critical.
it really is critical.
Right. And now, from what I gather, I talk to so many people whose kids are getting sick because they were wearing masks for so long that now they don't have any resistance. So everybody's getting sick.
And that is
it's not
something that
COVID.
is really important to
Yeah.
mention.
Mhm.
So this year, we have had so much COVID, and also we've started seeing the flu. Like
Yeah,
we have had
exactly.
patients with really bad flu.
Bad.
And then we have had patients with other respiratory viruses like RSV, respiratory syncytial
Yeah.
virus,
Yeah.
parainfluenza. And those are all respiratory viruses that cause a lot of damage to the airway.
Actually, my guest tomorrow couldn't come because she's got 2 kids that are just off and on sick, and they're coming home with different things,
Right.
but
And
really
then
violent.
Yesterday, I saw a patient that had been diagnosed with having the flu at Memorial Hospital, was given the steroids, and then mom called really frantic on Monday that the child was continuing to cough and have problems. So I ordered a chest x-ray, and the child had a pneumonia. So that's the other thing to
That's
remember,
great.
that the flu, it can lead to airway damage and then can lead to asthma. And sometimes when the lower airway, so remember that our airway here, it's larger, and as we go deeper, it gets smaller.
Mhm.
So the smaller airways, if the smaller airways are occluded like this and there is so much mucus, then what's going to happen is that the mucus gets stuck there. And then normally we have a lot of bacteria up here in the nose, the mouth, the throat. And then we have vocal cords here. So the vocal cords kind of, if you have a healthy airway,
Yeah.
our reflexes here prevent the bacteria from up here going down into the lower airway. But when your airway is irritated, then and if you have all that mucus, then the bacteria drip down and cause pneumonia. So sometimes patients with asthma will present as recurrent pneumonias. Sometimes with croup, patients who have recurrent croup may have asthma. So asthma is a common illness. Many years ago, when I was at the University of Miami, we had done a survey among high school students,
Right.
and 20%, so the 1 in 5, had symptoms of asthma.
Really?
Many of them were not even
diagnosed.
diagnosed.
Yeah.
So then, it changes your life.
Wow.
When you have all that airways inflammation and swelling, patients can't exercise.
Right.
So if you have a patient that says that I can't exercise or I can't swim, that's something I see frequently in children, that every time the child goes into the pool, the child gets sick. So if you don't have a healthy airway, that would happen. So when you start treating properly, everything gets better.
Yeah.
And exercise is really important for asthma.
Yeah. I forgot when we started talking, before I even told everybody what she does. She's the vice president of outpatient clinical trials at Kids Medical Services, Inc. But she's also the medical director of Pediatric Pulmonary Center and the International Travel Clinic. And that's just 3 of her 8 jobs. I don't know. You are the busiest woman I know.
I've
And I
been
thought,
doing this for so long that I've learned a lot of things as I went along. And something I have to tell you, I
what?
continue learning from my patients.
I bet.
And I really appreciate that.
Yeah. Well, I think just the explanation you've given me so far is probably more than I've ever known about asthma. Um, it's very enlightening. So I hope everybody else is enjoying this as much as I am. So there is so much else going on with with COVID. We were talking about some of the things that you've done. Now that everything is opening up and people are traveling more, especially people with asthma, what what is the best thing they can do if they're, say, taking a trip? Is there anything they can do?
So, first of all, I have to say that we're seeing more patients with COVID this week than we've had for a while.
Yeah.
Since last week, I've had at least 2 or 3 new COVID infections
right?
in my office.
Oh,
And
my
then
goodness.
when
And
I
you're-
talk to the families, the parents have been sick. So COVID is still around. Fortunately, especially for those who have been vaccinated,
Mm.
um, the symptoms are mild
Mhm.
and they may last just 3 to 4 days, but it is around. And COVID is a respiratory virus like any other virus. So before you travel, you want to make sure that if you have asthma, you want to make sure that your airway is as clean as possible.
Mhm.
The other thing I have to mention is the upper airway, the nose.
Mhm.
Normally, we're supposed to breathe through the nose so that the air gets cleaned
Cleaned.
and warmed. Large particles that may be in the air, they get cleaned,
Mhm.
uh, stuck there, so then you pull them out. And then it gets humidified. So you have to also make sure that you have a healthy nose in order to have a healthy airway. So
How do you have a healthy nose?
learn to breathe through the nose. If you can't breathe through
Oh,
the nose, then there is a problem. The
there
other
you
thing
go.
I have to show you, because I
Okay.
am very much into environment, the air we breathe in leads to nose problems and airway
Mhm.
problems. So it is very important to have our home environment
Mhm.
as clean as possible. And if we're outdoors, to avoid allergens that can be a problem. So, for example, when we had all the mango trees and the avocados and the oak trees blooming, all that pollen
Oh, I
and
had it.
so you see how your symptoms probably were much worse than in the winter.
I never get colds, but I was
The
just
nasal congestion,
a drippy nose
and right,
and the
right.
eyes.
So
Yeah.
all those things
Yeah.
cause problems. So, for example, I tell my parents if it's really breezy and there's a lot of pollen in the air, then try to stay inside
Or how about just wear a mask? Does that work?
or wear a mask.
There you go.
And really, masks are very important. They
I know I
prevent
usually have one on my
illnesses.
wrist wherever I
Yes.
go.
And then in Florida, indoor environment is really important. We have to, we have high humidity
Mhm.
and it's warm. So even if you have AC on all the time, the humidity in the air is still there.
Mhm.
And dust mites,
Oh,
these are little things that look like cockroaches, but they're microscopic. Dust mites live in upholstered furniture, mattresses, pillows, stuffed toys, carpets, etc. And you can't see them. So whenever you move around, they get aerosolized. And somebody who has an unhealthy nose or has asthma, the dust mites can irritate and cause problems. So environment control is really important. And I've had patients like this. I'll have parents who say that the child wakes up sneezing in the morning. So then we'll review the bed. How many stuffed toys do you have? Do you have the special hypoallergenic cover around the mattress or the pillow?
right.
Because if you cover all of that up and have less exposure, it helps with
So there's
the
no way to
nose.
get rid of dust mites.
There's no way of getting rid of
You,
dust
all
mites.
you can do is
You can vacuum as much as you want, but they're there.
they're there.
So covering them up with the
Bad.
hypoallergen covers is
I'm going to go get
important.
that. I'm going to go get
And
pillow covers
then,
today.
I don't have a family history of asthma or allergies or
I don't need it.
anything,
Yeah.
but once I started doing this, it's like I just got covers for everybody.
Yeah,
And
just
whenever
because.
I get new pillows, I cover them immediately, because prevention is always the best.
Mhm.
It may be expensive to start off with, but long term, it really does
Yeah.
help. So indoor environment is really important. The other thing that people do is, lately there has been like this thing about using diffusers with natural oils. And that's, like lavender to soothe, or eucalyptus to open up the airway. So those diffusers are actually a problem for people who have airways problems,
Really?
because the reason it smells is there's tiny particles
Right.
that you inhale, and that's how you smell them.
Isn't that funny?
But those are also chemicals. Even if we think they're natural, eucalyptus or lavender, it's still a chemical there might be a little bit of oil in it that continues the irritation. Using perfumes, if you have an airway problem, can be a problem.
Mhm.
And then many people use Vicks and Vicks Vapor Rub, or the Vicks things that you put
Yeah.
in the outlets. So the Vicks may help with the congestion initially,
Uh-huh.
but later on it can actually make things worse. And then people use
So
plugins.
you use it short term if you're going to use
Minimal,
Yeah.
yes. And definitely don't use it in like a like lately there have been Vicks that you can use as plugins, so you don't
Yeah.
want to use that.
What about when you go to a spa? They have. First of all, I hate the smell of spas, and I know I'm crazy, but I don't like the eucalyptus. I don't like any of that. I just like.
So temporarily it's okay,
Yeah.
especially if you have a healthy airway. It is
But
soothing
what if you're
and okay,
working in
but
one of those places, and you're exposed to it all the time? Not
yeah,
great if you have asthma.
and that actually is known as occupational asthma.
Is that right?
So
Wow.
working in spas,
Spas.
etc., nail salons,
Oh yeah.
hair makers,
Oh, yeah.
hair
Oh, especially when they do that keratin or whatever that treatment
keratin,
is.
and then
Yeah, that's bad
that,
stuff.
and then people that work in certain factories where they have a lot of chemicals in the air.
And so if you're one of those people and you're in a nail salon or you work in a spa, what is there anything you can do to minimize
The only
the
thing you
exposure?
could do is to use like a really strong mask, like a
Uh-huh.
K95, which
Yeah.
really closes the airway.
That's what I have.
But
yeah.
it's quite uncomfortable to keep it on the whole time, so that
Yeah.
becomes a problem.
Yeah. But I guess if you have a bad enough reaction,
Y-
you have to do
People
it.
have had to change jobs. I know
Yeah.
of people that
Oh,
had
really?
to change their professions just because they couldn't work in that environment. They were having chronic asthma. And
Yeah.
actually, women in their 40s in
Yeah.
Miami-Dade, this is another study we had done with the health department and the CDC. We found that women in their 40s were starting with new onset asthma.
Really?
And if you think about it, many of them may work in those professions.
Oh,
We
that makes
didn't
sense.
have the funding to look further into all of that, but that was
But if
really
anybody
very
wants to
interesting
provide
for
that
me.
funding, you can contact the doctor. But yeah, you've done a lot of research.
Um,
What research have you done that you found most impactful, or that you were most proud of? Maybe there's so many.
So the asthma study that we did with the health department and the CDC, that was a really big study, and we had good funding from CDC.
Yeah.
And that helped us understand more about asthma in Miami-Dade. It was particularly about prevalence of asthma and what causes asthma. And so with this study, we were able to visit a lot of homes in different neighborhoods and figure out what are the allergens, the indoor allergens that are causing problems, and how we can mitigate those and
So it
help.
could be anything from mildew to
Mildew,
just
mold,
mold.
dust
Yeah, right.
mites,
Yeah.
plugins,
Oh, plugins.
because they smell really good as well, but that can cause
Oh, wait, I
problems.
use those.
And then somebody actually told me that with the plug-in, sometimes what can happen is that oil can drip into the electric outlet, and then there's a risk of fire. This was I
Really?
had somebody come and do inspection of the house, for insurance reasons, and he mentioned that. So these are inspectors, building
Wow.
inspectors that know what they're doing.
I have a lot of those.
So anything
gonna
that
think
smells
class
good,
twice about
avoid.
putting
You
those, yeah.
just have plants that absorb the toxins, and there
Okay.
are plants like that. So
Kids, Christina, Kathy, do you hear that? Because we all have a lot of plugins.
get plants.
Oh my, yes, exactly. Yeah. Oh my gosh. So okay, how about just aerosol spray?
When you're
Well, no,
not,
for making things smells go away.
yeah.
What is the safe things to use?
As long as it's ventilated.
Okay.
So when you use it,
Make sure the
ventilated.
fan's on or something.
One
yeah.
of the things my parents used to do was use Lysol. We tell
Oh,
them
yeah.
about clean environment, so they
Yeah.
would use Lysol with the babies around. So I would tell them, just do the Lysol because it is good, but take the baby away, or put
Don't
the
have him
Lysol
smelling it.
on a cloth or something, and then
And wipe.
wipe it rather than. But definitely don't aerosolize all over.
Okay, well, okay, but just for odors, bathroom odors, like we have them all around here. We have little sprays for the bathrooms and whatever.
Those are okay because those are temporary, and then usually you have a fan in the bathroom as well.
Yes, you probably don't really need it.
So that's
unless
not
it's
a
very
problem.
offensive.
No, but the other thing that is very helpful is air purifiers.
I have one of those,
and the air purifiers do make a difference.
And those aren't that expensive.
They're
really
not
something.
expensive. They used to be expensive, and they're not. And I have to tell you this story. We, at work. Yeah. We had this really great IT person who was starting to get a lot of asthma exacerbations. So we were discussing what was going on. And what had happened was that as our business grew, the number of computers and servers and printers and all those increased. So the IT person was in a room that's less than half the size of this room, sitting like this, but then covered.
This is like 15 by 20 or something,
so
right?
His was maybe like 7 by 10 or something.
Okay, yeah.
But his whole wall was covered with all these servers and computers and printers. And printers, when you print, you'll smell stuff.
Right.
That's a chemical that can cause problems.
Oh my goodness.
So then, we couldn't remove those things. So he got a desktop air purifier.
Really?
And he was cleaning that air purifier every 3 or 4 days. That's how much dust there was. And then he got better as well.
Oh my goodness. Well, that's good to know.
So there's a lot of.
I think there's going to be an upsurge in that market after this show.
But it really does help.
Yeah.
And then humidifiers, air humidifiers. You never need them in Miami, South Florida. You do not need them. And when they have like baby showers, that's one of the things that's given to young mothers. So I tell my parents, go get.
No, you need a dehumidifier.
You need a dehumidifier or an air purifier. So don't open your humidifier. Go and exchange it.
Oh, good. Okay, good advice for moms to be if you get one in your shower. Yeah, but up north they need the humidifiers because it's so dry.
But not in South Florida.
But never,
not in Florida.
So think about other research you've done.
So the thing that we're doing now, which I'm really proud of, is we're completing a trial with a vaccine for pneumonia. For babies. So, like I said, influenza can lead to pneumonia. As we get older, our immune system is weak, so it leads to pneumonia. There's one group of bacteria called pneumococcus, which is a common bacteria that can cause a lot of
Pneumococcus, yeah.
disease. In babies, it can cause ear infections and lung problems, etc. So there has been a pneumonia vaccine available for many, many years until the one we have for children.
Adults. Oh, right.
For both children and adults.
Okay.
So the one that we have for children right now protects against 13 strains. And we're completing a trial looking at one that protects against 20 strains.
Wow. So
to see how much of an impact it makes in their lives. The pneumonia vaccine for 20 strains is already available in adults. And, any trials, any new product, it comes out first for adults.
Yeah, exactly.
And then pediatric trials, especially for babies that are in the first year of life, those are much more difficult to do.
I bet.
So once the product has been proven to be safe, that's when we do the pediatrics. So we're completing that. So I'm looking forward to having that product in the market for our little babies in the near future. So that is
exciting.
Yes.
Yeah. So, but for adults, there's one with, I wonder what I have. I know everybody in the audience is going to, which one do I have?
Strains just came out within the past year.
So. Okay. So we all need to call our general practitioners and say, which one do I have?
The other study I had done, and that's why I'm so much into air, is an NIH study that we had done looking at air purifiers that went into the AC unit. So there was this really smart it wasn't a physician, he was an engineer.
Yeah.
And they came up with this device that you put in your air conditioning unit where the filter goes. You sort of put it in there.
Yeah.
And then so it was designed, you needed to have a their own technician to come and put it.
Oh, okay.
So the way the design is that some people got the real thing and some people got not the real thing. And we didn't know until later. So then we put this in, and we had patients with moderate asthma. So patients that were taking asthma medications 2 or 3 times a day, and even then they needed oral steroids. So we did that study and then followed them over time. And this was a national trial. So there were a lot of different centers.
Right.
And that one also showed that the ones that had the real filter, their asthma got better, and we were able to cut back a lot of their medications.
Oh, wow.
And the nice thing about the study was that once the study was completed, those who had the fake filter, they were given the real filter.
Oh, that was nice.
So that was another.
So are those filters very expensive? I mean, there's people
those filters have, they're just writing up the research and all of that.
Okay.
We had an abstract,
so it's still in trial.
But so they're not available yet.
Yeah.
But
that's something people can look forward to.
Something to hopefully that comes to the market, because bringing a product into the market is very expensive.
So initially it'll be very expensive to get them, and then the price will go down as more and more people get them.
Yes.
So as usual. Yeah, right.
Yeah. And then I just wanted to mention about medication, since we're talking about.
Oh yeah, we were talking about how the importance
and how some of these medications, they're approved for adults and then they come down lower.
Yeah.
So one of the things with asthma now, we're very fortunate that we have a lot of very effective medications that you only need to take once or twice a day for control of asthma, and that have minimal side effects. Most of these medications are taken inhaled.
Yeah.
So that is the problem that we have, because there are so many different inhalers out there that parents and patients get confused, and sometimes they don't remember the names and stuff. So I just wanted to show, this is just like an example of an inhaler. And this inhaler actually has powder medicine in it.
Oh, really? Okay.
So when you open it up, you heard the click. The medicine is already here.
Oh,
and then all they do is they breathe in.
Yeah.
And hold their breath, and that's it.
And they
So
do that.
the technique has to be good to make sure that it's
And we were
taken
talking
in
about you have to
properly.
do it right.
This is another device that also is a powder device.
Oh.
And again, you click,
You click it open.
medicine comes here. But this device actually needs more strength pulling in the medication. So, for example, this device a 4-year-old can do. This one has to be like 7 or 8. But reviewing the technique and using the medication properly is really important.
Critical, huh? Right.
Many times,
Ilian,
Yeah.
how much time do we have?
You guys already went past, but you guys can keep on going.
Okay, keep going.
That's my problem. I talked.
No,
too much.
that's no, not at all. You should go ahead and show
Um,
this. This is important. And if anybody
So
has asthma, this is important.
And yes. So babies obviously can't use devices
Right.
that they have to breathe in. So for them, we have something called have devices that have powder, liquid,
Liquid? Okay.
and then we use this. We put the medication here,
Uh-huh.
put a spray, put this on the baby's face
Yeah.
to cover the nose and the
Nose and
mouth.
mouth. Yeah.
And there's filters there for the nose
Oh, right. Got it.
and the
Uh-huh.
mouth. So you put this on the face and the baby breathes it in, and it takes about 10 seconds to get the medication in. And these devices come with different size masks for different size faces.
Exactly.
And it's very effective. Whenever you
interesting.
use inhalers like these, the amount of medication that you get in is very little, but it goes directly into the air. And in this case, it also goes through the nose. So
Right.
it helps because many of these inhalers have steroids in it.
Yeah.
And people are always worried about steroids.
Yeah.
Like, do I have to take the steroid all my life?
Yeah.
The amount of steroid in here is so little that when you get sick and you get 5 or 6 days of oral steroids,
Uh-huh.
the amount in here, you can use this for about 6 months
As compared to the short
as
term.
compared to the short term. If you
Yeah.
look at the milligrams that
Right.
are there.
So it's not something that people need to worry about.
And then
That looks like it's for a child as well. Look
This
at,
is
oh
for
my
child-
God, is that
because
cute?
a lot of the babies have nebulizers. It's like a machine that
Yeah, yeah.
aerosolizes, and that takes about 5 to 10 minutes to do, and kids don't like to hold it. So this is just something cute for the kids
That makes
to kind
them-
of think
yeah.
that they're playing a game.
They're
or
playing a
something
game.
like
Yeah.
that.
Oh, that's
So
so
the
cute.
nice thing is that for asthma, there are a lot of different medications, and as long as we have good environment, clean, so we were
Clean.
not breathing in things that are causing persistence of the symptoms, and using the medications correctly,
Yeah.
asthma can be controlled with minimal effects. Just sorry.
This is this has been so informative,
Because
and I thank you so much.
with the steroids,
Yeah.
with kids that are growing up, there's
Yeah.
always a concern: are the steroids, the inhaled steroids, are they going to stunt their growth?
Okay.
And the good thing is, if the medication is used properly and your asthma is properly controlled, then the child grows nicely. They don't have to use oral steroids. Their exercise tolerance improves. And, kids like to run around. And the more
Right.
you run around, then the better you're going to sleep. And when you sleep well, that's when you grow.
Exactly.
So steroids do not stunt growth if you use them properly. And they're very safe.
Well, that's great. Well, this has been the most informative show I have ever done, I got to tell you.
Thank you.
And I thank you so much for coming. I maybe have you back again sometime, because this was great.
I talked too
Um,
much.
But before we leave, I want to thank again South Florida PBS, allhealthtv.com. Check it out. Become a member if you're not a member. And I will see everybody next week. Have a great day.